Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bring you another really interesting guest involved in creating a better tomorrow. Today, we continue on what I like to refer to as our virtual road trip around the world. We are heading over to the Republic of Somaliland, where we have the honor of being joined today by Saeed Nur Ahmed, who is the chairman of the Medicines Regulatory Authority within the Ministry of Health Development of Somaliland. He is also the organization's national COVID-19 vaccination coordinator. Saeed has his master's in public health with a focus on epidemiology from Ahmad University in Hargeisa, Somaliland. He did his undergraduate degree, bachelor's in pharmaceutical sciences from the International University of Africa in Khartoum, Sudan, and he spent over the last decade working as a public health professional with a pretty broad range of focuses, including epidemiology, the vaccination program, issues related to regulatory affairs, antimicrobial resistance, and a wide span more. Very interesting set of stories I'm going to be getting into today. Excited to have him. Saeed Nur Ahmed, thank you so much for taking the time to come on the show today.
Thank you very much, Ira, for having me. I'm glad to join your session. Thank you.
It's great having you. It's great being able to obviously have these technologies to hear these interesting stories from all over the world. Love to start off though, as we typically do, by just handing you the microphone for a little bit to talk about you. If you could take us just into your background story, a little bit about who you are, where you grew up, how you got interested in pharmacy, of course, in epidemiology, and a little bit of the early story. I think that'd be a great place to start off before we get into some of the broader themes that we'll be talking about.
Thank you very much. That's a good question. My story with pharmacy is fascinating. I joined medical school before joining pharmacy. Pursuing my undergraduate degree in pharmacy in Sudan. So I had the ambition to improve the healthcare system and contribute to addressing the challenges that are faced in healthcare systems in Africa and particularly in my country. So I had the ambition of also science and improving or contributing to the science and innovation. So I joined in medical school here in Hargeisa after finishing my secondary school in 2005-06 academic year. I joined the medical college at the University of Hargeisa in 2006. And when I was, it's like interesting because when I finished like 3 semesters or almost 2 years, I got a scholarship from Sudan. So I wanted to join medicine in the first place, but later on I changed, and it happened that I got into pharmacy. And I was thinking like it was the right choice because given the regulatory challenges and the lack of the regulatory, regulations to control the import or the trade of medicines in our country, it was really a big problem. So anyone could open a pharmacy. So that's then I got the motivation to pursue in pharmacy. And it was an interesting journey. I traveled to Sudan in 2007. It was October, so a new country with a new environment, but it was very interesting, and I have learned a lot in terms of the culture of the people also, and also in the pharmacy, it was like a big school. So we did a lot of chemistry, medicine and chemistry. So I was delving into my dreams of also. I was very interested in drug discovery. Was one of the great areas that I really got interesting to learn about pharmacy and how it interacts with the it relates with the other medical courses. So then later on, I finished my undergraduate 5 years degree. Then I came back home here, and I joined different in the academic sector. So I started as a pharmacology lecturer in the different universities in the country, particularly the University of Hargeisa, Goldis University, and also I joined a new project, which was Italian pediatric healthcare project here in Hargeisa, where early in 2013 I was recruited as a project pharmacist. So I was then going there into hospital pharmacy and also medical logistics and supplies, working in a pediatric healthcare project as a humanitarian project funded by the Italian IDA, the Development Corporation, and also other partners. So maybe I could do a story here and then you ask me questions, or I will continue.
Yeah, so, no, it's
really later on. I had this in mind that the improving the pharmaceutical sector regulation was a pressing challenge issue in Somaliland. So that was, so I was working also in those different areas, like, different projects, academic, hospital, pharmacy. Later on, I worked as also as a consultant for Somaliland Development Fund. It was an Italian, it was donor funded by the EU, donors funded project in Solar-Sanag, which is a remote area, regions, 2 regions in Somaliland. So then that was about 1 year and a half I was working there in a remote setting, supporting the procurement and supplies, and also building the capacity of the staff, medical staff in the two hospitals, and also developing the guidelines for rational use of medicines, treatment guidelines, and also drug management, supply management, capacity, and what do we call the LMIs. So, it was a mixed career, and a cocktail of, working in different areas in the healthcare system in Somalia.
Yep. And so, before we get into some of the different areas that we're going to be talking about, I was wondering, Said, if we could just take a step back for a moment because, a couple of years ago, one of the guests that we profiled, who was leading up the Somaliland Medical Association was Dr. Mohammed Mosa Hassan, who is now with Médecins Sans Frontières, but who introduced us at the time to sort of the general theme of, almost building a medical system from scratch, and just for, obviously the American audience and maybe other audiences that are going to be watching this, say a few words about Somaliland in general, because, obviously we hear about Somalia, but Somaliland is a sovereign state that is obviously connected to it. But if you could just give us a little of the background there and a little bit of some of the challenges per, in essence, you building a system from scratch, in your case, medical pharmacovigilance and all the other things we'll be talking about. Talk a little bit of background here again, just to reintroduce the audience to Somaliland, and a little bit of its history, let's say.
Okay, that's a good question, Ira. Somaliland it is not officially, recognized as an independent state. It's an autonomous state, but it was a former British colony, so called British Somaliland. It gained independence from the British Empire in 26 June 1960. So it was under the umbrella that Somaliland was a British colony, and the southern Somalia was also an Italian, Italian colony. It's like Somalis are like in 5 now regions. Some of them are Djibouti, also gained independence later in 1977. So Somaliland's history is long. It dates back to centuries, it is like after gaining independence, like 4 days, our southern, the southern Somalia, which was the Italian Somalia, we get into unity, unification, which was effective 4 days after our independence in Somaliland. But there was a disagreement, and also among and how things are, resources or power dispute. So there was disagreement, and then Somaliland reinstated its independence in 1991. So it's functioning, it's peaceful, it's democratic, and you have free and fair elections. As recognized by the international community, and it has as functioning, it's a fully functioning state with its security, with its currency, banks, the private sector, army. So that's it's still from 32 years into reinstating the Somaliland as an independent state. Still, it's a dream that's under pursuit. In Somaliland. Excellent. But still the international community, yes, it deals with Somaliland as an state, but not officially recognizing, but in the UN or other official platforms. But still, it's put also into. So it's important that it's good to tell people our story.
Yeah. I wanted to put that part of the story there, because just so everyone can understand, you don't just have these broad responsibilities, but it is in the context of a unique sort of, as you just pointed out, sovereign yet unrecognized state. But again, I wanted to give the background there to give the full story about this the environment geopolitically and so forth that you operate within. But that being said, now let's talk about some of what you've been up to, because it is quite impressive and rather broad, and I think a very interesting place to start, based on your what you were just talking about before in terms of the background in epidemiology and all sort of the logistics side of things. You were instrumental, per the Ministry of Health, in working with agencies like the WHO, like UNICEF, involved in this major COVID-19 vaccination rollout. Close to 1 million doses across the spectrum. So, the everything from the J&J to the Pfizer vaccines and everything in between, training hundreds of public health professionals across the country in, I think, 11 different regions. Take us into this story, because clearly a very important responsibility for the entire country. Walk us through a little bit what's going on back in 2021.
Thank you very much, Ira. That's a really very good question, but it's a big question. I mean,
take your time with it.
Yeah. Thank you very much. Yes, it was part of the team, the ministry. I was fortunate to be nominated as the COVID-19 vaccination technical coordinator. I mean, supporting the technical, the operational, and also the coordination of the COVID-19 vaccination rollout in early 2021. So that's really it was a huge task. But before I get into the COVID-19 vaccination a little bit, I will give you a background on the pandemic era. In early 2020.
Yep.
So yes, as a part of the COVID-19 pandemic response activities. So I was at the time I was as a regulator and lead chair of the Medicines Regulatory Authority, the Ministry of Health, which is under a Department of Health Services. So I was leading this program of implementation of the National Medicines Policy. So we have done a lot in terms of improving the capacity of the pharmaceutical sector, and in collaboration with various partners, including WHO, in preparation of the treatment guidelines, training the healthcare providers in irrational use of medicines, which is a big problem, the irrational use of medicines, if you do not manage cases according to the evidence-based interventions. So it was really a challenge in terms of our regulatory system is at WHO maturity level 1, according to the WHO GBT, the global benchmarking tool. So we have done in 2017 GBT assessment with IGAD and the WHO as a technical support. So strengthening the regulatory system was really an ongoing process from 2016. So nomination of the Medicines Drug Regulatory Board. So as a regulator, my also background in the regulatory system, and also the regulatory harmonization, contributing to initiatives of regulatory harmonization and technical collaboration at different levels, particularly at Eastern Mediterranean region and WHO Eastern Mediterranean region. So I participated, several conferences and as a technical working groups. So that was one of the things that gets back before the COVID-19. Mm-hmm. But I will connect it with the COVID-19, sure. And then you have at the African level, we have the IGAD. At IGAD level, there is a regulatory harmonization initiative at IGAD level, or just like any other, regional economic community, like Africa is IGAD, ECOWAS, West Africa, or Eastern African Community. So I was contributing to this continental also regulatory harmonization to improve reliance and do some activities. So at the time, I attended a conference organized by NEPAD, African Union Development Agency, or NEPAD, in Zimbabwe in late 2019. So I submitted a paper on the regulatory, challenge in Somaliland, and then the risk of the substandard and falsified or other challenges, regulatory challenges in Somaliland. So my abstract was accepted, and then I attended the conference. But that was really a great opportunity where I joined the African Medicines Regulatory Harmonization Initiative, which was at the time part of the continental efforts to improve the regulatory capacity and the landscape in the continent. So really, joining, and those task forces were really, important to connect and also build the capacity at continental level in Africa. And later on, when the COVID-19 pandemic surfaced in December 25, 2019, Wuhan, China. I was part of the team, the ministry that was supporting the national COVID-19 pandemic response. In terms of working on treatment of case management guidelines, the IBCs and the contact tracing and epidemiological surveillance, also working with different partners. And so one of these technical teams, I was part fortunate to contribute to the national efforts by the ministry, led by the ministry, to prepare the national COVID-19 response, and the pandemic response plan at the time. Mm-hmm. So it was really challenging because the COVID-19 was a new disease. It was so every day there were challenges with its epidemiology or how it's transmitted. So from this level at the international and regional levels, I was also a part of this team, contributing to the development of, for example, at African level, we have done the African Medical. I was a member of the African Medical Devices Forum. Mm-hmm. So I was nominated then as a member of the COVID-19 task force at African level. So we were revising guidelines, working guidelines on a screening of the IVDs or other assays. The diagnostic, preparing the national list. The continental lists for essential, diagnostic products for COVID-19. So it was like a connected story at these levels, and also the R&D, which is the research and development of new drugs for COVID-19, was ongoing. So really, these connections were also that contributing at continental level and also at national level. So at national level, we have prepared these guidelines, and by the lead of the Ministry of Health Development, we have organized workshops to train the healthcare providers in these guidelines. And also we have prepared, as a medicines regulatory authority, national critical COVID-19 supplies, list, which is like an essential medicine list. We had essential medicine list. So, but this is based on COVID-19. So, supporting the ministry to devise, an appropriate and also an effective response operation is the COVID-19 pandemic. So, lastly, in 2021, and then I joined also another task force, which is a national COVID-19 vaccination task force as a lead technical member. So with the support of also other teams, the administrative interdepartmental teams, as you know, the vaccine was new. The vaccines were new, and it was really fortunate for the international, community that we have a COVID-19 vaccines. Shortly, like within a year after the surface of the pandemic. Mm-hmm. So quickly we have prepared. We have utilized. I think because it's a long story, but I think I would just one of the key remarks I would like to emphasize points is one of the things that helped us was we had access to resources in terms of with the also support of the partners like the WHO or UNICEF. In terms of the technical expertise, and also I was responsible for preparing the guidelines. Supporting the guidelines. Also with the support of the team, particularly the WHO such guidelines for this is expert committee for vaccination. Mm-hmm. So one of the things that helped us was this access to technical resources, and also we have utilized the existing infrastructure, or platforms like the coordination platforms in our healthcare system in Somaliland as well. It has a good foundation. So there are structures at regional or up to district level management. So at each level, there's the regional or the district level health administration, teams. So we have just repurposed, I can say, like we just oriented them, mm-hmm. and we engage them to prepare the national preparation of the national vaccination and deployment plan. So we have prepared quickly. We engaged them also to put these as a participatory approach, and then so they can support the later on the implementation of the vaccination. So we have received the AstraZeneca from the first time, mm-hmm. 65,000 doses from AstraZeneca. At the time there was an outbreak of COVID-19 and the mortality was very high, and the local transmission was very high, and hospitals were getting. So Somaliland was waiting, and people were waiting us so that we can devise this plan and then execute it in a timely manner. So there was challenge with the time. So quickly we revised. We prepared the SOPs and guidelines, and we trained the regional. We implemented in Hargeisa. We trained about 70 healthcare leaders, which are cold chain, the EPI, the social communication mobilization. All these teams at regional and district levels, we trained them in Hargeisa. Mm-hmm. And then, so it was like a quick preparation, working with the ministries, because, at the time, the COVAX allocation was to allocate 3%, to vaccinate 3% of the populations in those eligible countries. So the vaccines were not available. The supplies were very scarce. So then there was prioritization to vaccinate only those old people, or those at risk, and also the front line, like the health workers or the police, the parliament, those working at the points of entries. So we were prioritizing and mobilizing, also working with the different state institutions, like the ministries, the parliament. Mm-hmm. So it was really a large work that was ongoing. But at the end, we were very successful. We implemented our first campaign from 29 March to like a 10 days campaign up to 9 of April, I think. So we have achieved about 89% of our target. Yes, was delivered, and I think our vaccine wastage was not very high, like 3 or 2%. So really, it was an amazing, but I can say also we're fortunate to achieve this target. I mean, we did with all those circumstances that I was emphasizing. And I think the last point I would like to emphasize is the importance, as a lessons learned, is the importance of this collaboration, and also uniting, resources and efforts, as well as the importance uh, of social and community mobilization. Yes, and mobilization. So at the time, we have conducted a high-level, um, uh, I mean, a high-level, engagement of the public. Like the president was vaccinated, so the president was the first person to be vaccinated. So this was like building the trust
Right.
of the public, and as a role model, and also the parliamentarians, the ministers, Minister of Health. I mean, all these league teams. So this was like, as you understand, there were rumors about the vaccine safety or effectiveness always in the community. So I will stop here. Thank you. Sorry.
No, it was an extremely impressive story and rollout, and again, you talking about how you integrated this all into the existing structure. It's extremely impressive and timely rollout. It's interesting, as you just mentioned, the issue with sort of population trust and things of that. It got me thinking of something else I wanted to talk to you about, because we a couple of years ago, I had the opportunity to profile this Lome initiative, which began in Togo, on this issue of substandard or falsified medical products. It's a global issue, but specifically this initiative is focused in Africa, and heads of state from Congo and Niger and Senegal and Uganda, a few other countries were there. Interested just sort of getting from your responsibilities, not just during COVID, but in broader sort of pharmacovigilance and regulatory oversight. What's the status of, how do you look at sort of the current environment, per whether it's Somaliland or sort of the broader region, per the issue of these substandard products, how you're doing in protecting, in your particular case, the market from keeping these types of products out versus obviously the quality registration regulation. Any interesting stories on that front? Because I know this is another part of your responsibility.
Yes, thank you very much. Yes, for bringing this question. It's really important to fight. To address the problem of the substandard and the falsified medicines, which is on estimation, according to some reports like WHO, about 10% of products circulating in pharmaceutical markets at global level is 10%. And so really, given the weak and the porous national borders, the substandard and falsified medicines prevail in areas as long as you have a weak regulatory system. So I can say it is really important to emphasize that our regulatory system is not very strong in terms of health or medical practice. So given this preamble, we have been throughout the years working with partners to build this capacity to allow early detection and also surveillance of substandard and falsified medical products. So one of the key things that we do is the post-marketing surveillance. So we have, yes, our laboratory capacity is not very strong as I would like to be, as an ideal. I mean, our laboratory capacity is not strong. But since 2009, we have been doing work with the mini labs. Mini labs are GBHF. Yes, so they can do, as these basic analytical or quantitative the chromatography, the TLC. So we conduct about quarterly. Sometimes it was more frequent, or it was at large scale. So we target mostly different areas like the public sector and sometimes the private sector. So we collect like random samples, focusing on the priority medicines, like the essential medicines. There's this for malaria, there's anti-infectives, anti-inflammatory or analgesics. So we conducted these quarterly based post-marketing surveillance, and then we screen at the MRA laboratory. So that's one of the one of the key things. Another thing is awareness. Like we receive the sometimes alerts, like from WHO. We collaborate with WHO global surveillance system for substandard medicine. So we receive alerts. So we closely monitor also that, and as soon as we receive an alert, it's circulating either in the region, like in Africa, or in other regions. As they disseminate, we disseminate, we share with the ministry, we share also with partners, as in emails, like all those people who are in the supply chain areas, to report. I mean, even at our MRA, although because still our budget is not very strong, wish to disseminate those in the Facebook or Twitter page that we have also to the public. And always like you need to engage the public. I mean, to inform them. This is like formed, and governance. But at the same time, also having this diligence that people may misinterpret the information that you share. So with the caution that this may affect only the products that are provided, like with the image, for example, you put the image and with the patch number or something like that, and then we disseminate. That's also one of the strategies. But another important, strategy is building also the capacity of the private pharmaceutical sector. You need to empower the private pharmaceutical sector. So since 2019, we have been conducting training. So sometimes we conduct, although we have resources. As I've mentioned, in terms of financial resources are the policy also commitment for medicines regulation. At that continental level and also in Somaliland, it exists. So really, it's important that we're supposed to receive more emphasis. In terms of having, those resources from the government to allocate for building an effective system. But we were doing with our efforts as what we have. So we have been training the private pharmaceutical sector members on the risk of SF, substandard and falsified products. There was also a database. It is like an Excel based at the time, since 2019 or 2020. So we try to train them on if they see any product that's suspected to be substandard or falsified products. So we trained the private. There is in Somaliland, our private importers of medicines, they have an association. So we trained, we engage even their leadership. So training and also building their awareness, increasing or enhancing their awareness so that they can cooperate with the ministry. And so it's like a mutual also, a collaboration. So we conducted some trainings for them, also training their technical teams on these risks of substandard, and if they say how they could report, who they would report to at the contact point at the ministry. So there's all say in this regard.
Excellent. Say one other area I'd love to touch on. We've talked about vaccines. We talked about, as you were just mentioning, issues with substandard, falsified medicines. Another part of your bio, which I neglected to mention, is that you also spent the last couple of years as a member of the International Pharmaceutical Federation's Antimicrobial Resistance Commission, and this is a topic that we have touched on a lot lately on the show, not just because it's a big problem and we haven't been developing enough antibiotics since the 1980s, but that there's nothing in the pipeline and we have to have strategies. You were involved in the recent AMR survey per the IPF on antimicrobial resistance and stewardship and pharmaceutical education. I noticed you didn't do some publication yourself. I saw a paper you recently published on otitis media and certain antibiotic susceptibility patterns in Somaliland. Talk a little bit about what you've been up to here, because this is, we normally talk about it in terms of, okay, this is a big global issue, but stewardship at the country level, at the pharmacy level, this is where the action happens. And if it's not just about developing new antibiotics, there's a lot of other things that are happening on the ground. Talk a little bit about what you've been up to and what you sort of some of your strategies are in terms of Somaliland and the region.
Thank you very much, Ira. Also, thank you for bringing this very important topic. As you have emphasized, yes, AMR, it has this attention global, and it seems that now it is like gaining more attention than before.
Yeah.
And I've watched some of the also the videos that you post on YouTube. It's very interesting to also your interviews with some experts in this field. So the burden of AMR, the key here I would like to emphasize is it needs a comprehensive approach. It needs a comprehensive approach. So at the national level, it is important to have this intersectoral collaboration. Having the national action plans for AMR. So in 2020, we have been working with WHO team, or Essential Medicines Program, to prepare the national action plan for AMR, which is, as you understand, a comprehensive tool that will allow for intersectoral collaboration, bring together the ministries, environment, agriculture, and those areas to address the issue of AMR, building the capacity, enhancing the surveillance of the antimicrobial resistance. This laboratory-based as the one I've done on my paper, as well as enhancing the capacity to also do the AMC component of the glass, which is the consumption, monitoring and reporting the consumption of antibiotics. So yes, we have almost finalized at the time, but then there was the COVID-19, so then our focus has shifted to that one. So fortunately, we didn't come to the point that we come to the implementation. One of the issues that affects the AMR, or antimicrobial resistance, which is, if maybe some people are watching here which are not expert in the field, the development of mechanism is that the germs that is used causing germs develop to resist the action of those drugs that we use like antibiotics. So is the promotion of rational medicine is used. So we have been conducting like the antibiotic awareness week, yeah, the 13th November. Wow. Also, the treatment guidelines, the national treatment guidelines. So we have developed the 3-level STGs for hospitals and for primary, hospitals and health centers, and also at the health post level in Somaliland is according to the EBHS, the Essential Package of Health Services. So in 2015, yes, we have finalized the treatment guidelines, and from that on, we have trained many healthcare providers. Like we have conducted, several workshops at different regions. Sometimes in collaboration with partners, and sometimes as that we implement directly. With the support of partner collaboration, or sometimes we support the partners, some of the partners, some of the NGOs that work in the health sector, like in the EBHS, the primary healthcare system. They have their own funds sometimes, so we just bring them to the technical expertise, and we provide them with the copies of the guidelines, and we monitor the quality of their training. So we were using a multiple, hybrid approach to train the healthcare providers on the rational use of medicines, particularly the management of the case management of the common diseases as per the WHO. The latest WHO evidence-based guidelines, which are mostly applicable to be adapted in low resource settings like in Somalia. And this is one of the also key aspects that we have been doing in contributing to this. And last point is about the FIP, the FIP. So I joined the first task force of the AMR Commission of the International Pharmaceutical Federation in 2020, as you have read in my profile, and it was at the time also the COVID-19 pandemic was also ongoing. So it was just this continental, international level team, 14 members. So me and also another colleague from Zambia, we're from Africa, to devise and advise FIB on the commitment to FIP. So we have done a lot of work after that in 2021 and mostly in 2022, particularly a survey to monitor, the cap, the knowledge, attitude, and practices of healthcare providers, practitioner level or trainer, in terms of emphasizing the importance of understanding how AMR is integrated into the pharmacy education or even in medical education. So the key point is addressing AMR needs, this policy commitment. Apart from that, it needs collaboration, and it needs building the capacity. Understanding what are how AMR is what's the perception of AMR among those different communities, including the healthcare providers. So we have done a lot of work later on, particularly in the FIB AMR Commission commitment to AMR in those in Sevilla in Spain in 2022 September, and also there was like those events that me as a member or as a commission, we have been contributing to address, to commemorate the importance of AMR. And last point is at the ministry level in the Medicines Regulatory Authority, we've also we promote the rational medicines use. We circulate, even in social media page, the importance of rational medicine use, particularly in even COVID-19. like in early COVID-19 era, there was the time that people sometimes were referring to other non-evidence-based treatments. So advising the public that there is no treatment at the time. So they closely follow, the guidance from the ministry, and they do, or a trained medical healthcare provider, and they don't listen to, they don't take anything like sometimes anti-malarials. People we sometimes are resorting to other things.
Side, what else is coming up? What because I noticed, you, in addition to all your responsibilities, you've also been doing a tremendous amount of training, of professional development. Yeah, I see you've been involved in everything from sort of rare disease conferences to personalized medicine. You mentioned the thing in Barcelona recently in terms of epigenetics and infectious diseases. What else is coming up for you? Things we should know about, conferences that you may be attending, where we could run into you possibly. Anything else that I missed that you want to mention, please take the floor.
Thank you very much, Era. That's really an important question. I think I contribute, to a different, fields. Or I'm engaged in different, platforms in terms of as a technical working groups. So the key areas is, for example, my involvement in evidence-based medicine, brain, as a member of the methodology group. Also, the importance of the pharmacogenomics so also I've joined the African Pharmacogenomics Network. So really, also my focus more is on COVID-19 or other pandemics, preparedness and the response. So really, these are the areas that I will emphasize, and the most importantly, the importance of reliance. Reliance to regulatory reliance. So reliance was very important in pandemic response in terms of developing procedures for like the emergency use authorization, or you rely on as a regulators on the decisions from other NRAs like stringent regulatory like European Medicine Agency or other or WHO listed authority. So these are like my key emphasis areas on technical collaboration. Regulatory contributing to regulatory initiatives, particularly in African level. There is the operationalization of AMA, which is the African Medicines Agency. So yes, I was, as I was mentioning before, a member of these task forces. So currently, AMA the treaty was ratified. So there are ongoing efforts by the African Union Development Agency to operationalize the technical working groups of AMA. So I had this story of contributing to the establishment as a technical working group member. So it is great, and I'm really happy to see that right now at continental level, Africa is improving to collaborate and then operationalize this agency, which will allow at the end to will enhance the access to effective and quality safe medical products indeed in for African people. So that's the key emphasis point. So if you would maybe address another question, really very glad that you have me, and thank you for the invitation and for great discussion.
Yeah, no, again, I'm very impressed by, once again, the breadth of everything that you're involved in, and again, in building a strong public health system there, and really appreciate the story. You sharing it with us. For everybody again that is going to be listening to this particular episode of our show across the various podcast networks, or watching on the YouTube channel, you've been listening to Syed New Ahmed, who is Chairman, Medicine Regulatory Authority, Ministry of Health Development of Somaliland, also their National COVID-19 Vaccination Coordinator. Syed, I want to thank you again for taking the time out of your schedule to come talk to us, to educate us on some of these themes for a little while. Obviously, thank you for everything you do. And as we like to say on our show, thanks for helping to create a better tomorrow via what you do. A really great story, and wishing you the best with as you continue to do it.
Thank you very much for having me, Ira. Thank you very much.